Okay, so good morning and welcome to the pre-operative education class for total knee and total hip patients. Some housekeeping items we need to go over today. This webinar may be recorded for educational purposes. At the top or the bottom of your screen, there is probably a Q&A button or a chat box button or a little hand button. At any time during the webinar, if you have questions, if you need to let me know you can't hear me or you can't see the screen, just feel free to type something into that Q&A box or that chat box. You can also email me any questions, to askortho@elizabeth.com. Okay, and we're going to go over that again at the end. There is a short survey following the webinar, so if you wouldn't mind filling that out, that would be great. It does take a few minutes to load, so I would give it 30 seconds or so. Once you click out of the webinar, it should pop up for you. Okay, so welcome to class and congratulations on your decision to have a total joint replacement. These replacements can be quite life-changing. We understand exactly how you feel with all the pain that you have, and we really just are excited to help you get back to, feeling better in that quality of life that you want. So congratulations for that. We're going to start off today with a video. When the video is over, I'm going to be joining you again. This video will talk about what to do before surgery, what to bring with you, what's going to happen when you come in, where to go, those types of things. So I'm going to turn this video on, and again, once I see the end of the video, I'll be back and we'll continue on with the rest of the education.
Welcome to St. Elizabeth Healthcare. At St. Elizabeth Healthcare, our goal is to keep you and your family comfortable and well-informed before and after surgery. Here are a few tips to help you get prepared for your upcoming surgery. For your safety, your doctor may want you to have some tests, such as x-rays or blood work, before your surgery. These are called pre-admission tests. In some cases, your surgeon may ask you to see one or more of your specialists to approve you for surgery. The pre-admission testing, PAT department, performs tests ordered by your surgeon to assure your safety during surgery. A complete health history and testing are performed to confirm that you and our care team are prepared for your surgery. It is necessary for the pre-admission staff to also be aware of all medications you are taking. Bring all your medications in their original bottles, including any prescriptions, over-the-counter, vitamins, and supplements with you in a Ziploc bag. This will help our care team know what and how much medicine you are taking. During your pre-admission testing visit, you will be given instructions regarding surgery preparation, any medications, if applicable, and what to expect on the day of your surgery. Plan on your pre-admission testing visit to take approximately 1 hour. If you are scheduled to be discharged home after surgery, please designate an adult 18 years or older as your care partner. A care partner's role is very important. It is recommended that a care partner bring their cell phone so we can contact them throughout your surgery experience. For example, your care partner will be updated on your progress during surgery. Care partners must be available to stay with the patient and provide care for the first 24 hours after surgery. The night before your surgery, please follow these steps to keep you safe. As a safety precaution that must be followed by every patient, before your scheduled procedure, do not eat anything after midnight before your surgery. You may have the following approved liquids, including water, sports drinks, black coffee, and tea. No milk, creamer, or sugar, up to 2 hours prior to your scheduled arrival time. For your safety, do not eat, smoke, chew tobacco, chew gum, use breath mints, or recreational drugs. If your physician has assigned you to be in the Enhanced Recovery After Surgery Program, or ERAS, you will receive additional instructions regarding eating and drinking before your surgery. These instructions will be provided during your pre-admission testing visit. If you take medication on a regular basis, don't worry. You will be told during your pre-admissions testing visit which prescriptions you can take on the day of surgery. If you have any questions, just ask your pre-admission testing nurse or your surgeon. The night before and the morning of your surgery, Take a full bath or shower with antibacterial soap or soap provided during pre-admission testing. Wash your hair to reduce your risk of developing an infection after surgery. If you're like most people, you always want to look your best, but remember, you're going to have surgery, so give yourself a break. Do not wear any perfume, makeup, deodorant, lotion, or baby powder to the hospital. You can brush your teeth, but remember not to swallow any water in the process. Wear comfortable closed-toed shoes and loose casual clothing that is easy to take off and put back on. There are a few other things you need to remember. If you wear eyeglasses, contact lenses, hearing aids, or dentures, you should bring them along with a storage case and any other supplies you need. Jewelry, such as a ring, must be removed prior to your procedure. If you are unable to remove your ring, please see a jeweler to assist you with the removal. As a precaution, you also should bring any important legal forms, like a living will, custody documents, or durable power of attorney. This information must be complete prior to your arrival. If you would like more information on preparing an advance directive, our pre-admission care team can assist you. You must bring your photo identification or driver's license, Medicare and/or insurance card, and co-payment when you register. Also, bring any paperwork your doctor has given you, like permits and lab orders. It will help to bring a file for your paperwork to the hospital. Leave items you do not need, like money, jewelry, and credit cards, at home. If you bring your wallet, purse, or keys, give them to your care partner for safekeeping while you are at the hospital. Now let's talk about what you need to know when you get to the hospital. Getting to St. Elizabeth Healthcare is easy. For your convenience, St. Elizabeth has multiple surgery sites. If your surgery is at our Edgewood location, enter through the patient entrance 3A. If your surgery is at one of our other locations, enter through the main entrance. You may check in the lobby. If you need help, please ask, as we are happy to help. Unless you are told differently, plan to arrive at the hospital 2 hours before surgery. It's that easy. For a map and other details, go to www.stelizabeth.com. Next, you and your care partner will be directed to surgery. Let's cover what you can expect. During your stay, safety measures, such as confirming your name and date of birth, will happen multiple times. You will be taken to the same day surgery pre-op to prepare for surgery. During pre-op, you will meet your care team, change into a hospital gown, and have your vital signs taken. You will notice that the pre-op area is a busy, well-oiled machine that may feel overwhelming. To help you understand what to expect, your pre-op care team will give you a surgery passport card. This card is a checklist to keep you up to date on everything that will happen before your surgery. No one likes to wait, but delays are possible. Your surgery start time often depends on the patient treated before you. You will be updated about every 30 minutes. Before your procedure, someone from the surgery team will check your armbands, review your forms, and ask some questions. The operating room is a large space with specialized equipment and lighting. The operating room may feel cold. Just let us know if you are uncomfortable, and we'll be glad to give you some warm blankets. You will be placed on a bed that is designed for surgery. The bed may seem narrow, and your arms will typically be outstretched to your sides. Keeping your care partner informed is very important, so they will be updated by the Pre-Operative team approximately every hour while you are in our care. Your surgeon will also contact your care partner after your surgery. After your surgery, your nurse will be monitoring you closely. They will help manage your pain, answer your questions, and keep your care partner updated. When you are ready to be released from the hospital, your care partner will join you to review your discharge instructions. You will be given written discharge instructions for your review at home as well. If you will be staying overnight at the hospital, you will be taken to your room. Your care partner will be given your room number and visitation guidelines. Your stay in the hospital depends on what kind of surgery you have. Regardless of how long you stay, we will provide excellent, safe care and do everything we can to make your stay as comfortable as possible. If you have any other questions, ask your doctor or any member of our care team. Thank you for choosing St. Elizabeth Healthcare.
Okay, so that video showed you pretty much everything you need to know prior to surgery when you come in that day. They did leave a few things out of the video though, so I want to go over a couple more things. During your preoperative time, when they're preparing you for surgery, you are going to see your surgeon, and you're also going to see your anesthesiologist. They both come and see you prior to the surgery. If you have a nerve block ordered, this is where that nerve block will happen. Obviously, we want you to ask any questions that you have. You probably already know, but you do have to have a COVID test prior to surgery. We want you to bring also a list of anything that you're allergic to, especially if you don't know it off the top of your head. We want to know anything that you're allergic to, food wise or medication wise. Okay. If you have any changes in your health condition between now and surgery, we want you to contact your surgeon right away and let them know about that. The day you come in for surgery, we need you to have no finger or toenail polish on, no acrylic nails on, and no makeup on. Okay. Do not shave your operative leg for 5 days prior to surgery. And then we just want you to know that we do prophylactically or preventatively treat patients just in case you're a carrier of MRSA. And we do that by just using an iodine swab and cleaning up inside both sides of your nares, okay? So that's going to take place in that pre-op area as well. Okay, so let's talk a little bit about surgery. Surgery is about an hour long, okay? Usually an hour, give or take a little bit of time. The one thing you need to know about surgery is this. The surgeon is going to pull some of your muscles, and it makes perfect sense if you think about it. You know, the longer we have arthritis, the worse it gets, the less we move that joint, okay, because of the pain and the stiffness. If we're not moving the joint, we're not moving the muscles. So if you're not using your muscles like you should, they atrophy, they shrivel up, they shrink, they get tight, those types of things. And then once the surgeon goes in there to remove the bone and place the joint, he has to make sure that that joint is in there exactly where it needs to be, that it's the correct size, and that it's going to give you the best outcomes possible. So he will test that prosthesis, and he does that by moving that joint in all of the different motions and range of motions that it will go through. And he does that over and over again just to make sure that it's going to function properly for you. When he does that, unfortunately, he's going to pull some of your muscles, and that can lead to some pretty substantial pain following surgery. The muscle pain, most patients say is the worst. Like I said, it can be substantial pain, but you know, with icing and elevation and pain medication, you can typically keep that under control. So we encourage all of those things for pain control. The video talked about if you went home. It did not talk about what would happen or where you would go if you are admitted. If you do spend the night, you will go to our orthopedic unit on the 7th floor, more than likely. We have all private rooms. We have a big flat screen TV in every room. We have room service for your meals. There are lots of helpful staff. You're going to see your nurses, your nursing assistants. You may see the managers. You may see me. I'm the coordinator for the program, and I try to round on all the patients if you are admitted. You are going to see either your surgeon or one of his mid-levels. It might be his PA or his nurse practitioner. One of them will round on you daily. You will see care coordination more than likely if you have any needs for discharge. And then you're probably obviously going to see therapy. You may even see occupational therapy. It depends on what your needs are. But you will see therapy before you leave, okay? We do have a discharge medication delivery service here, and this service is available for patients who spend the night as well as patients who go home the same day. So what this program does is it allows us to fill your prescriptions for your pain medication and your anticoagulant and anything else the doctor might order for you at discharge. That allows us to fill those here prior to you leaving so that you can take the medications home instead of the pharmacy scripts and have to stop at the pharmacy on your way home. So nobody enjoys doing that. So we've come up with this program. Patients love it. You do not have to do anything ahead of time. Basically, what you have to do is just come in. We'll find out if you're interested. If so, we'll enroll you in the program. The pharmacy will fill your prescriptions, and then right before you're discharged home, they'll deliver those to you and collect your co-payments. Okay. So it's just like going to a pharmacy. It's just our pharmacy instead of your pharmacy. It's a one-time thing. You don't ever have to use this again. It's just a thing to help make your transition home a little bit easier. Okay. So hopefully you take advantage of that. Security measures and visitor clearances. All visitors have to be screened at the front door, obviously because of COVID. That means that patients have to park in the front of the hospital at the front entrance next to the emergency department. So they will park in the parking garage, okay? Come in the front door. Visiting hours are from 11 a.m. to 7 p.m. every day. You can have 2 visitors a day. Once those visitors are gone, no one else can come in until the following day, okay? So it's 2 visitors, and that's it per day. Safety measures and alarms for patients. We do have a couple things that we ask for patients, and the biggest one is basically, you know, not to get up without us while you're here in the hospital. And there's several reasons for that. You know, you had just had surgery on your leg. That leg's going to be weak. It's probably not going to hold you very well right away. If you've had a nerve block, it may be numb. Your knee may buckle. You've lost some blood during surgery. You have had pain medication and anesthesia in your system. Those things can make your blood pressure drop. You can get dizzy, lightheaded. You can pass out. And so the one thing we do ask, guys, is that you call for assistance before you get up out of the bed or the chair, okay? We will come in. We will be happy to help you with anything. Just make sure that you're calling us first, okay? All right, some equipment that you're going to see here. I'm just going to briefly talk about these. This is a bed that you will see if you are admitted. This is a trapeze, and that's just to help you move around in the bed if you need it. This is an incentives spirometer. I call this a deep breathing machine, and we're going to talk about that a little bit later when we discuss pneumonia. These are A boots, okay? These boots, they're just Velcro sleeves that wrap around your legs, fill up with air, and when they do, they squeeze your leg and then they let go. We're going to talk about these later as well. And these are to help prevent blood clots, okay? Next to that, this is a picture of your ice pack system. There's a bag to hold it all. This is your ice wrap. It's Velcro as well. There's 2 gel packs in the picture, but you actually get 4, okay? 2 will be on your leg while the other 2 are in the freezer. Next to that, down here at the bottom of the page on the right is a pair of TED hose or TED stockings. These are very tight, almost like pantyhose socks, and we sometimes put these on patients, and again, they're to help keep from developing blood clots as well. On the far right here is a picture of a walker. This is the type of walker we want you to have. We want you to have a 2-wheeled walker. 4 wheels is a little too mobile. No wheels you have to pick up, and then we don't like that either, because if you're picking it up, you don't have anything securing you and making you stable. So 2-wheel walker is the type we want.